The number one most important muscle when dealing with SI joint pain, whether it's on the right side or the left side, are the left abdominals, the left internal obliques, and the transverse abdominis, and this video is going to explain why. When I was suffering from SI joint pain for about 14 years, from sophomore year in college until about the age of 35, when I discovered Postural Restoration, which gave me the answers that I was looking for, it was horrendous. You never forget your first SI joint blowout. And the pain is just debilitating. And this occurred for me during those 14 years from about 3 or 4 times a year. It would go out and I would not be able to stand up for a week, and then I'd still be achy, and if I returned to activity within 3 weeks, I'd probably re-injure it. Now, of course, there was no actual injury, because what you realize underneath all SI joint issues are breathing issues. And it's the structure, or it's the way that we breathe due to the position of our body that is the issue. Now, I do demonstrate a postural restoration technique at the end. You could skip to it, but I don't really know why you'd want to do that without understanding why you'd actually be using the technique and what it's trying to achieve. Now, what are the SI joints? Well, you're going to see them right here. Here's the back of the pelvis. You got one on the left and one on the right. And these SI joints, they have movement available to them as you walk forward. There's rotation going on in this pelvis. The sacrum is rotating right and left, or it should, and that's the issue. It should rotate right and left as the iliums, as each side of the pelvis is coming forward or back. This is called walking. Now, of course, I'm exaggerating the amount of movement here just to show the concept. It's not going to move that much, but nonetheless, this is what occurs. You go to your right side, so this would be my right side, the left side of the pelvis comes forward, the sacrum turns to the right. When you go to your left side, the right side of the pelvis comes forward, the sacrum turns to the left. That's alternating activity, and that's what should occur. But because we are all right dominant humans, which I'm going to get to, with more muscle over on the right side, with a core, you have 2 cores. You don't just have you don't just have one core. You have a right core and a left core because you have 2 different diaphragms. The right core is stronger. Your brain is more connected to your right core, which means that we're more likely to shift our weight over to our right side and have the pelvis come forward on the left and orient the sacrum to the right. Postural restoration calls that the left AIC pattern, and that is because we are right dominant, the activity of the hemispheres of our brain, which I'm not going to get into in this video, but primarily because of this bigger right diaphragm. So here you see a picture of a spine and a right diaphragm and a left diaphragm, and then the pelvis and the associated musculature underneath. You'll notice that underneath, at the psoas, the iliacus, the pelvic diaphragm area, and the lumbar spine, and the QLs, it's all symmetrical. But above that area, the right diaphragm and the left diaphragm, those are 2 different muscles. And the right diaphragm is much bigger. And that is what produces this rightward orientation, this rightward shift of our center of mass, which is completely normal in an asymmetrical human, which we all are. Does the bigger right diaphragm actually matter? Well, yes, it does. So as you see in this prediction, now this is a cadaver, so I hope people don't get grossed out, but hey, it's the human body. That you can see that that cadaver, that rib cage, that thorax, because you're looking up, this is my right, is oriented to the right. The sternum is oriented to the right. Everything is oriented, turned towards the right side. That's the influence of the bigger right diaphragm. We all exist like that to one degree or another. Again, that's not a problem. The problem is when that normal asymmetrical rightward orientation becomes extreme. In the case of someone who has SI joint pain, that orientation has become so dominant that you're no longer able to get off of your right side and get to your non-dominant side, which is called the left side. And that is the issue. Over time, the SI joints start to ache because of airflow issues. We stop breathing with our diaphragm, particularly on the left side, and we over-rely on the right side. And as we stay shifted to the right, certain muscles will start to weaken and others start to become overactive. And that asymmetrical activity on both halves of our body will cause SI joint pain for many people. Now here's the rightward orientation again. As this individual lies on her left side, the right side of her body is falling backwards. When she lies on her right side, the left side does not fall backwards. So the picture on the left, again, that's the bigger right diaphragm rolling her back on the right side. You see this all the time. Could you see it on the left? Because I know someone's going to say, well, this happens to me on the left. It could, but it just means that instead of having one side being not positioned properly, both sides, you're just in complete extension. Your back is arched, your ribs are up, you're just extended on both sides of your body. And here's another individual. The picture on the left, he's rolling back on his right. At the end of the session, now this person didn't have right SI joint pain, but he is asymmetrical. And of course, the SI joint pain is because of asymmetry, excessive asymmetry. At the end of the session, that's how he laid down. So we inhibited his overactivity of the right side of his body, his right diaphragm, his right abdominal wall, probably his right neck, his right inner thigh, everything on the right, which I'm going to show. That was inhibited, and he finally started to use his left side, which pulled his right side forward, and he's now able to maintain that position. I didn't ask him to do that. He just lied down like that, and I just thought it was great because I took a picture, and well, that's why I took a picture, because it was so obvious. Now, if you look at someone lying down from the top, you'll see this individual is side bent to his right. His right abdominal wall is way overactive because he's depending on his right diaphragm, which is pulling his lumbar spine to the right. And again, that's what it would look like quite often from the top. You may even see a rib flare. Now, this is a bilateral rib flare. Usually you'll see it more prominent on the left. You don't try to treat the rib flare. That makes no sense. You treat the asymmetry that is underlying the rib flare, the asymmetrical breathing. And in this case, this individual I know was he didn't have either diaphragm working properly. He was a neck breather. And that's what produced the bilateral rib flare. And here's just an example of the general patterning of what needs to be inhibited. You'll see a right neck, a right pec minor, right abdominal wall, right inner thighs, right calf muscles, and right QL, which I do have it labeled. So that's all on the right hamstring, right calf, right QL. And on the left side, what you're going to usually have to inhibit is your left lower back muscles and your left quads. Now, at the end, again, I'm going to show techniques that could conceivably do that with the caveat of this is not easy. So I always recommend someone see a Postural Restoration Institute credentialed therapist to help you with this. So remember, underlying all musculoskeletal pain that is not from an injury, it's idiopathic, meaning can't figure out where it's coming from. The underlying issue is going to be this asymmetry. Now, the breathing mechanism. You can see the respiratory diaphragms and the pelvic floor diaphragms. They have to work together. They have to pump together. So when you take a breath in, both of them should go down. And when you take a breath out, they should both go up, meaning all four. So the two respiratory diaphragms and the two pelvic floor diaphragms, pelvic floor muscles, as you take a breath in, they should go down. As you take a breath out, they go back up. When you're on your right side, you're going to be using your right diaphragm more than the left. When you go to your left side, the non-dominant side, you should be using your left diaphragm more than the right, because it depends on which side you're on. It's redundancy. You have two diaphragms, which is a good thing because you could get diaphragmatic paralysis, which happens, but you'll still have a backup. So that's the canister like you got the top and you got the bottom. But when your pelvis is forward on the left, which puts you over on your right side, you lose the left diaphragm and the left pelvic floor because the pelvis is no longer in the center. It's like this. So if you look at the bottom, it's going to misposition the pelvic floor muscles. And as that happens, they can't pump so easily as breathing muscles anymore. So the whole respiratory mechanism falls apart. When you lose your left diaphragm, that's the one you're going to lose most often because you're a right dominant human. You prefer to be over on your right side. At that point, your brain has to use other muscles to help you breathe. And one muscle that it's going to go to very quickly is the right QL. So here's a situation. Once you end up on your right side, your right glute gets very weak because you can no longer use your right glute to push you to the left because you can't get to the left. So the right glute gets weak. Now that right glute supports that right glute supports the right SI joint. It also supports the left SI joint, but in a roundabout way. So when you're in this position for too long, because you're over on your right side, and the testing will show this, like this type of test, it's going to show if you cannot adduct both legs, if you can't adduct your left leg, that's indicating a body that's over to the right side in what Postural Restoration calls this left AIC pattern. It's just creating problems with the SI joints. They can't move anymore. The right side is getting jammed up. Actually, it's being gapped. It's getting jammed in the front, but it's getting gapped in the back. It's being pulled apart. So we have to use a right glute to pull that back together again as the pelvis turns to the left. But as the right glute weakens, that's part of the normal walking cycle, don't forget. This is just walking and breathing. However, when you get stuck in this position, the right glute gets weak, you can't push to your left side, but your lumbar spine still has to rotate a little bit to move forward. So quite often people will get ligamental instability, or they'll stretch out ligaments, the iliolumbar ligaments that are in the back, lower right quadrant, will often get stretched out, and that can add to instability on the lumbar spine and the SI joint. At that point, the right QL becomes notoriously overactive to help stabilize this lower right quadrant. But it also becomes overused as an accessory breathing muscle. And as your brain is using those QLs, and it can happen on the left also, but as the right QL is being overused as more of an exhalation muscle, it just holds you on your right side. So you could try to stretch your QL, because that's quite often what the remedy is, but the attempted remedy, which I did many, many times, but it doesn't really change anything in the long run, because you still need to learn how to get to your left side to close the right SI joint as you go to the left. So just stretching a right QL will not do anything in the long run until you can learn to get back to your left side. That's the underlying issue. You're stuck on your right side. So what do you need to do? Well, you do need a right glute, but the right glute will never get you to your left side if you don't have left abdominals primarily. So yeah, stretching the right QL could help. Strengthening the right glute could help. But the problem is this. If your pelvis is turned to the right and you're trying to strengthen your right glute, all you're going to do is strengthen the right glute. That's going to hold the pelvis in the aberrant position. You have to be able to get to your left side first. Turn your pelvis to the left. Turn your sacrum to the left to close the gap in back, and then learn how to use the right glute with a pelvis turned to the left. Teaching your right glute to get stronger when your body's was still stuck on your right side is really just going to strengthen the segments of the right glute that hold you up on your right side. We need the segments of the right glute that push you to the left. Otherwise, you can't change the position of the SI joint and close the gap. That will require left abdominals that will pull the ilium, the left side, to the left, and that's what you're seeing. Your center of mass has to shift left. The right glute and the left abs together will inhibit or tone down that right, or release that right QL. But it's never a one exercise thing, or one technique even. It's going to be a multiple techniques. That's why you need help. And for some people, this will not work if they have too much, if they're hypermobile, that's an issue. So what I'm going to show, it works easier for people who are not hypermobile and who have not been neck breathers for a really long time, and who don't have anything going on with their visual systems or their jaw or their teeth, which I cover on this channel a lot. So you'll see the left abs will shift your center of mass to the left from the top. It's gonna work on the top of the pelvis on the left, but you're also gonna need a left hamstring, which the technique at the end does show, but I'm also gonna show how you can use another technique for the left hamstring that could help solidify this new position that you're trying to get into. Now, the name of the game in postural restoration and dealing with any of these musculoskeletal issues is not really facilitation, it's inhibition. It means turning off inappropriate overactivity of the dominant pattern, of the dominant right side. So, we have to not only learn to feel your left abdominals and your left hamstring and yes, your left inner thigh. That can only occur, that process of facilitation or of activity can only occur if your brain will let go of the overactive muscles that it's using to cover up for the instability, and in this case, the instability in the SI joint. So quite often, yeah, the right QL has to be inhibited, let go of. But at the same time, what we're really talking about is you need to be able to expand your rib cage with air in two primary places. One is on the right side. That's what you'll see. The right side has to expand so your body can shift to the left. But then on the left side, your left lower back, your left lower and mid back has to expand with air so your body can go to the left and move back on the left. It has to be able to flex on the left because on the left side, it's living in a state of extension. So those two areas, and again, the 3 techniques that I show at the end will help this process. Expand the right side of the rib cage through inhalation. Expand the left lower mid-back area through inhalation. And use a left abdominal activity and a squeeze of your right glute to help reorient you back to the left side, which will help close that gap. As you do these techniques, the breathing process in through the nose, out through the mouth. Why out through the mouth? Because we want to elongate our exhalations so we can get our ribs to come down, because they're usually going to be flared up on one side or the other. Well, usually almost always on the left, but sometimes on the right also. So we really have to get all of our air out to get our body into more of a state of flexion. So you just in through the nose, out through the mouth, pause for 3 to 5 seconds before the next inhale, and then just try to direct the air and feel your rib cage expand with air as you're doing the techniques. And there is no like how many times do you do this type of thing. Just try it. A typical program would have someone work on these types of techniques for 3 or 4 sets of 5 breaths twice a day. So you'll notice I'm in a hands and knees position, and you'll see also from the side, my back is rounded. As I pick up my right hand, you'll see my weight shift to the left a little bit, and at that point, I feel my left abdominals. And I breathe in through my nose, out through my mouth. I'm trying to expand my back with air. This is what it looks like from the side. Pick up my right hand, I feel my left abdominals. My back is staying round, my weight is forward a little bit. When I point at my right glute, if I squeeze my right glute, I feel my left abs a little bit more. Now, you can compare. If you pick up your left hand, you should feel your right abs. Most people don't have problem feeling their right abs because they're already over on their right side. So generally, we don't really want people to feel the right abs even more. We need them to get to the left side. So when you pick up your right hand, you should feel your left abs, but you have to be able to keep your back rounded and your pelvis tucked under. So you're in a state of flexion and learning to breathe in that position. When your pelvis on the left comes back and your ribs on the left come forward to meet in the center, or actually to kind of meet in the front, that puts your left internal obliques and your left transverse abdominals in a position that they can actually activate again. And as they activate again, you can actually start to expand your rib cage with air, because you're going to be able to use your respiratory diaphragms along with the pelvic floor to pump air into this rib cage. Now, again, in this position, I'm trying to breathe into the left side of my left lower mid-back area. Now, I will get some expansion on the right side, but sometimes it's a little difficult. So the next technique would help with opening up the right side of the rib cage. So in this position, what you see is the right side of my rib cage is lengthened. It's expanded. The left side is closed, because remember, when you're living on your right side, this is my right side, when you're living on your, let me do it in your direction. When you're over on your right, the right side is compressed. Everything is being compressed on the right side, while everything on the left side is being lengthened. We need to just flip it. So that position is flipping it. It's bringing everything on the left closer together and lengthening everything on the right. And then all you try to do is breathe in through your nose, out through your mouth to expand the right side of the rib cage. And in that position, the right QL would lengthen as the left side is coming to, and that's the important part. Why would your brain let go of a right QL if it doesn't have something on the left to go to? That's why you can't just treat one side of the body. It's always a two-sided, total body issue. And the right and the left side are not the same. So you can't treat them the same way. And then one other technique you could try would be this 90-90 hip lift with right arm reach. This is the most important thing. You have to be able to sense your left heel pulling down into the back of your shoe while you're sensing the arch of your right foot. I talk about left heel and right arch in pretty much almost every video on this channel. It's all part of postural restoration. All 3 of these are postural restoration techniques. So in this position, you would be, theoretically, if you can do it properly, if your neck is not holding you hostage, if you're not too tense in other areas of your body that you might have to address first before you can feel your hamstrings, theoretically, when I pick my butt up, pull my heel down, the feet aren't moving obviously, I'm pulling my heel into the back of my shoe, my left heel, I'm sensing the arch of my right foot, and I'm squeezing a ball with my left knee only. I do not need more right inner thigh. I only want to squeeze with my left knee. At that point, I should feel my left hamstring and my left inner thigh. And, well, I do. So I'm saying you should. Now, you may not, because again, these are complicated. There's a lot of details. You have to get the breathing properly also. But as I do this, I'm blowing up a balloon. You don't have to use a balloon, but I'm using a balloon. As I exhale into the balloon, I'm going to reach my right arm forward. Why? Because as my right arm comes forward, it turns me further to the left. It will help bring my pelvis from a rightward orientation to a more leftward orientation by reaching forward as my left heel is being used to get my left hamstring into my life. The balloon helps with left abs, the two things that you need to get to your left side. And yes, you could squeeze your right glute in this position to help facilitate that. Now, you might not feel anything in your right glute. That wouldn't surprise me, because most people's right glutes are so turned off that they have to really work on stabilizing their left side more before they can actually get the right glute into their life. So these are just 3 techniques that can be used to offload your right side and help you start to get to your left side, to expand your rib cage with air into 2 really important areas, right side and then left lower and mid back, to help close this gap in the right SI joint area. It could also help decompress the left SI joint. Left SI joint pain is trickier, and I'm not going to get into that because it usually involves a very unstable left hip. And I've talked about it on this channel before. Is this all you would need? Maybe, maybe not. Most people, this would be 3 techniques as a part of a bigger program of stabilization, because then you have to be able to use these muscles in an upright position. But it's the same muscles. After a while, it's all going to be the same muscles and the same playbook. Get to your left side. But the hardest thing to do is just to get to your left side to begin with, because there are so many areas of the body that can remain tight that you might not be aware of. That's why I always recommend someone find a credentialed postural restoration therapist off the PRI website to help with these type of issues. It's very, very complicated. There's no such thing as one exercise that's going to fix, every SI joint issue. It's not how it works. You have 2 sides of the body. Hopefully through this video you can see it's a little bit more complicated than stretch this or strengthen this. Nonetheless, as someone who went through SI joint pain, debilitating SI joint pain for 14 years, I can assure you my lower body was never really, my muscles really not the issue. It was the position I was stuck in, the resulting respiratory, inability to breathe correctly, respiratory dysfunction. It was coming from my cranium, my jaw position, my visual system that was really holding me over on the right side, which I talk about in a lot of other videos, but it can be worked through. I never had to stretch anything, never really strengthen anything in the classical sense of working out. That's not what this is about. This is all working on the level of the brain and the autonomic nervous system and respiration. I would point out, if you're in acute pain with this SI joint issue, you might need to let it tone down. Any type of movement might set it off. So you have to be careful with any exercise, whether it's a postural restoration exercise, technique, or any type of exercise. When you're in the midst of an SI joint issue or episode, any type of movement hurts. So I wouldn't do any of this stuff when you're still in that acute period of pain, as much as you want that relief, I know. It's just that anything you do, the system is so cranky and so on edge, anything you do could potentially create some difficulties, or it might agitate things. So if you want to try something that one of these 3 techniques, you could start, I would say the safest safest in the sense of the easiest position to put yourself in would probably be the hands and knees position. If you can just if it allows your back to flex a little bit and just breathe in that position, you might feel a little bit of relief. But again, if you're going through an SI joint episode, I would try to let that tone down first and then deal with the underlying structural imbalance after the pain has at least subsided for the most part.